Hey everyone, today I'll be talking about congenital hypertrophic pyloric stenosis. First is what is congenital hypertrophic pyloric stenosis? Basically, there is hypertrophy of pylorus muscle by birth, which causes gastric outlet obstruction. Next, the question is, how would a child present to you? Actually, a mother would come to you with her 2 to 8 weeks old child complaining that the child does a lot of vomiting. On further examination, what you would come to know is that this vomiting is projectile, and the most peculiar feature, it is non-bilious. When you examine the child, what you would find is an olive shaped lump in the abdomen, peculiarly in the epigastric region. Also, what you would feel is reversed peristalsis, that is left to right peristalsis. Now, to confirm your diagnosis, you would go for some investigations. In a child, the safest investigation and the investigation of choice would be nothing but an ultrasound. And in ultrasound, what you would see is a target sign. Now here you need to remember few things. That is the criteria for diagnosing CHPS. The first criteria is that the length of pylorus should be more than 16 mm, and second, the thickness of pylorus should be more than 4 mm. Apart from this, you would also see a peculiar electrolyte imbalance, and the electrolyte imbalance that I am talking about is hypochloremic, hypokalemic alkalosis. Also remember that this will be associated with paradoxical aciduria. Now, once you have made a diagnosis of congenital hypertrophic pyloric stenosis, the next thing you would do is the treatment. Now, before planning anything, first what you need to do is correct the electrolyte imbalance. And to correct this electrolyte imbalance, what we give is N by 2 0.45% normal saline. And later on, what you can add is potassium chloride, that is KCl. Now the question is, how would you come to know that the electrolyte imbalance is corrected? This is seen on the basis of urine output. Once this urine output becomes more than 1 ml per kg per hour, and also once you see that the HCO3 levels have become less than 30 milliequivalent per liter, then that means that the electrolyte balance has been achieved. Now we can go for the actual management, and that is surgical management. And the surgery that we do for congenital hypertrophic pyloric stenosis is Ramstad's pyloromyotomy. So this was all about congenital hypertrophic pyloric stenosis. This is the overview of what I have discussed in CHPS. If you like this video, share this video and subscribe to my channel. Thank you.